Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're going to talk about Sickle Cell Awareness Month and our friend, Mr. Alazio MacArthur. He is Fayetteville's Regional Program Director of Piedmont Health Agency and Piedmont Health Services and Sickle Cell Agency. Now, during the second half of the broadcast, we're going to learn some ways that we can help patients with sickle cell disease through blood donations. You all hear me talk about it every broadcast. We're going to talk with Ms. Kristen Keefe. She is the Mobile Recruitment Coordinator with Cape Fear Valley's Blood Donor Center. Now, before we start the broadcast, I do need to let you know that this program is for informational purposes only, especially with what we're going to talk about today. This is not a time for you to self-diagnose. What you need to do is find yourself a healthcare professional. As I said earlier, September is National Sickle Cell Awareness Month, and Piedmont Health Agency and Piedmont Health Services and Sickle Cell Agency is well known here in the Cumberland County area and the Sand Hills region because it has been serving North Carolina communities since 1970. Now, their mission is to provide outreach, education, screening, and case management for people with high-risk problems. Ladies and gentlemen, please welcome to the broadcast Mr. Alazio MacArthur, Program Director of Piedmont Health Services and Sickle Cell Agency. Alazio, welcome back to the broadcast, man.
Thank you so much for having me, as always.
Now, Alazio, let's start with explaining what sickle cell disease is and how it's inherited.
Okay, so sickle cell disease is an inherited blood disorder. Inherited basically means that it's passed on from the parents to the child. So you're born with sickle cell disease. Sickle cell disease is caused by an abnormality in the hemoglobin, which is a protein in the red blood cells that carry oxygen to the organs of the body. So what ends up happening is your regular, normal red blood cells are usually pliable, they're circular, they flow through the blood vessels really, really easily. Those individuals with sickle cell disease, the red blood cells are brittle, they're sticky, and they're sickled shape, crescent moon shape. They do not flow through the body, through the blood vessels easily. So what ends up happening is oftentimes there's a clog in the blood flow, organs do not receive the oxygen that they're supposed to through the hemoglobin, and it causes excruciating pain. It also causes those particular organs that don't receive the oxygen not to live or function the way that they're supposed to.
Alazio, I've always thought, and I'm going to put it out there because I wasn't educated enough in it, I always thought sickle cell was an African American disease. But what I've learned is that's not the case. So how common is sickle cell in different communities? And how would you know if you're carrying this gene or you might carry this gene?
I'm so glad you asked that question. One of the things that we love to do, particularly doing Sickle Cell Awareness Month, is to provide this particular education. It is thought, and has always been thought, that sickle cell disease was a black person's or an African American person's disease, and that they were the only ones to get it. And that is not true. It's common in African Americans, but you can also find individuals who have, ancestry in Middle Eastern, Mediterranean, Asian, Indian, even Hispanics from Central and South America are carriers of sickle cell. Again, It is an inherited blood disorder, which means that it's passed on from parents. And what we know about this world is that we live in a very global society. So individuals, they cross borders. They live in different parts of the country. We intermingle. There are interracial marriages. And so individuals can have a trait, be of a different ethnicity, and for that reason, it's not just a black person's disease or an African American disease. Other individuals can carry sickle cell trait or sickle cell disease. 1 in 12 African Americans will carry the sickle cell trait. 1 in 365 African Americans will have sickle cell disease.
Wow.
The numbers are not that high in other ethnicities, but like I stated earlier, if you are of the Mediterranean ethnicity, if you're Asian, Indian, and when I say Indian, I'm not talking about Native Americans, I'm talking about Asian Indian. If you are Latino from Central or South America, you can also have sickle cell disease or sickle cell trait.
Concerns and dangers. What are the main concerns and dangers for people living with sickle cell?
As I stated earlier, when you have sickle cell disease, body organs don't receive oxygen. So one of the major concerns of individuals living with sickle cell disease is major organ damage, lung damage, acute chest syndrome, sequestration, splenic sequestration when your spleen is inflamed because you're not receiving the oxygen that you're supposed to receive. Eye damage, kidney damage. All of those are major concerns of individuals living with sickle cell disease. One of the other things is that because you have sickle cell disease, your immune system isn't intact and it doesn't, fight off infections. So opportunistic infections is also a major concern for individuals with sickle cell disease.
Mr. Alazio MacArthur on Making Rounds Live. He is the program director of Piedmont Health Services and Sickle Cell Agency. If you would like to be part of this conversation, what you need to do is call us at the WIDU studio. The number is 910-483-6111. Again, that's 910-483-6111. You can come on the air and ask the question, or you don't have to. You can leave the question with the amazing lady at the front, and she will make sure that we get that question to Alazio. Another way that you can do this is if you're watching the live stream by way of Cape Fear Valley's Facebook page, what you can do is leave the question in the comments section of today's broadcast, and Lindsay will make sure that we get this question answered. Once again, in the studio, Mr. Alazio MacArthur from Piedmont Health Services and Sickle Cell Agency. Let's talk about treatment, Alazio. How are sickle cell patients treated for the disease?
It's important to state that there is no cure for sickle cell disease. Treatment includes medication for pain, dietary issues, concerns, and primarily, basically, there's a lot of other things that people can do, like staying hydrated, making sure you eat properly, staying actively involved physically, making sure that, you're not just laying around, that your joints are intact and that, you can move and you have mobility. Those are just simple things, making sure that you're not too hot or you're not too cold, because those things bring on crises. It's a lot of things that you can do that can help you prevent going into what we call pain crises. The biggest treatment, though, is medication. Medication, making sure that you stick to your care plan, making sure that you attend your doctor's visits. Now, that is huge. A lot of times we have barriers such as transportation that will keep people from making their appointments on time or regularly the way that they should. But that's important, making sure that you see your provider when you're supposed to see your provider, making sure that you have your hemoglobin checked, your levels checked, so that things can be put in place to keep you from having to be hospitalized.
You mentioned the crisis that sickle cell patients endure sometimes. I know in the past when they have gone to the hospital, they have been treated differently. I'll put it like that. Has that gotten better?
It's getting better. I'm so glad you asked that question. One of the things that I would love to say is that that has been an issue, and we brought that issue before Cape Fear Valley. And Cape Fear Valley has taken that on as a quality improvement project. And we're so thankful and so grateful for Dr. Tracy Muhammad for taking that on. And things have gotten better. There's still a long way to go. I think as we educate our clients, as we educate the community, we also need to educate providers, because not every provider is a sickle cell specialist.
Exactly.
You know, sometimes, you know, medical providers only get a very small snippet of what sickle cell is when they're in medical school. So for a person to be an attendee in an emergency room who doesn't really treat sickle cell disease, sometimes there's an education that's needed, not necessarily along the lines of the clinical part, but maybe the psychosocial part, because sickle cell clients go through a lot physically, mentally, emotionally. They live with this condition all of their lives. And so when they come in and they tell you that I need a particular dosage of a medication that happens to be a narcotic, it's not that they're seeking drugs for recreation or because they are addicted. No, they are seeking drugs because they have a medical condition that requires them to have this particular medication. And so I think that education piece is one of the things that we're looking at Piedmont Health Services. We don't want to just provide education for our clients and to the general public, but we also want to provide education to medical providers so that our clients can receive the best care that they can. And I, again, want to say thank you to Cape Fear Valley for taking this on. That is huge, because that's not being done in other parts of the state or other parts of the country.
Blood donations, African American blood donations. How important are those blood donations to sickle cell patients?
Very important. Oftentimes when we think about blood donation, we think about emergencies or natural disasters where there's large pools of blood that need to be collected for individuals who've been harmed or hurt in those disasters. Well, for sickle cell patients, this could be a matter of life and death. We have sickle cell patients that oftentimes have to have regular blood transfusions. Some have blood transfusions on a monthly basis, some every 2 to 3 months, but they need these blood transfusions in order to be able to live productive and healthy lives. And so when it comes to blood donation for sickle cell clients, it is almost imperative that those blood donations are there. I am so grateful and so thankful that we have, you know, Cape Fear Valley has their blood donor center that we've worked with in times past for blood donations and collections. The American Red Cross here in Fayetteville, Cumberland County has also been very, very helpful. But it's important. It's important for African Americans, I stated earlier, that it's common. This particular disease is common amongst African Americans, but when we look at blood donations, African Americans are among the ones that don't donate on a large scale. And so we would like to increase that. We would like for that number to go up, not just for sickle cell patients, but in general. African Americans do well when they receive blood from other African Americans. And so we promote blood donation readily across the board.
Well, does it necessarily matter if the donated blood comes from an African American if it's to help a sickle cell patient?
It does not. It does not matter at all.
Ladies and gentlemen, Alazio MacArthur, the Program Director of Piedmont Health Services and Sickle Cell Agency on Cape Fear Valley Health's Making Rounds Live. Alazio, let's talk about Piedmont Health Services and Sickle Cell Agency. Explain the work that you all do for the community related to sickle cell.
Well, one of the biggest pieces that we do is provide education and awareness. Having us here on the show today to let people know what sickle cell disease is and the services and things that we provide is huge. Being able to talk about blood donations across the board is huge. So education and awareness is big. That's one of our big things. The other thing that we provide is medical case management and care coordination services. Individuals living with sickle cell disease that are born in our catchment area, which is a 4-county catchment area. We cover Cumberland, Harnett, Hoke, and Robeson counties, are sent to our office from the North Carolina Sickle Cell Syndrome Program through the Department of Health and Human Services. So As children are born, they're screened. They go through what we call the newborn screening process, and one of the things that they're screened for is sickle cell disease. So if an individual is determined to have sickle cell disease or sickle cell trait in our catchment area, that information is sent to us. We immediately reach out to the individuals to do a strength and needs assessment to see if they would benefit from the services that we provide, and if so, there's an intake done. Once that intake has been done, then we make sure, number one, that the individual is linked to a primary care provider. If it's a newborn, we deal with a lot of the pediatricians here in Cumberland County and our surrounding counties. If it's an adult, we try to make sure that they have a primary care provider. And then immediately they're linked to a specialist that deals particularly with sickle cell disease. Unfortunately, we don't have a lot of hematologists in our catchment area that specialize in sickle cell disease. So a lot of our clients attend the comprehensive sickle cell clinics at Duke and at UNC. That referral is made, the linkage is made, and then treatment is started as soon as possible.
Could you mention all the counties that Piedmont Health Services and Sickle Cell Agency serves again, in case we have some listeners that came in the middle of the conversation?
Yes. So we provide services in Cumberland, Harnett, Hoke, and Robeson counties for sickle cell disease.
If someone wants to find out more information, or if they want to access some of the services, what's the best way for them to do that?
The best way to do that is to contact us at 910-229-2393. Again, that's 910-229-2393. That number goes directly to our office here in Fayetteville. That's located at 907 Hay Street, Suite 202. That's in the Haymount Hill Historic District. Come by and just drop in, and we'll be able to help you with whatever it is that you need. And you can also go on to our webpage at www.piedmonthealthservices.org. That's www.piedmonthealthservices.org.
All right, Alazio, any final thoughts, anything that you want to stress again to the listeners, anything that we may have missed during the first segment of the show that you want to stress?
The only way that an individual knows, if you've not gone through the newborn screening process, to determine whether or not you have sickle cell disease is to be screened for it. The other thing is this. I mentioned earlier that 1 in 12 African Americans carry sickle cell trait. That's how the disease is manifested. If two parents have sickle cell trait, there is a 50% chance that they may have a child born with sickle cell disease. Oftentimes, individuals don't know what their trait status is. The only way that you know what your trait status is to be screened. And we do that in-house in our office here in Fayetteville at 907 Hay Street. So if you want to know, or if you don't know what your sickle cell trait status is, then please give us a call, stop by the office. We offer that service for free. If it's determined that you have sickle cell trait or sickle cell disease, then we do a whole family study or genetic counseling session with you to let you know exactly what it is that you can expect from your trait status or from your disease status.
All right. Alazio, thank you so much for your time this morning. We appreciate this, man.
Thank you. Thank you.
Ladies and gentlemen, Mr. Alazio MacArthur, Program Director of Piedmont Health Services and Sickle Cell Agency. Up next, we're going to talk to Miss Kristen Keefe about blood donation and how it helps sickle cell patients on Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
This is Reverend Dr. Patania L. Island, pastor of Hood Memorial AME Zion Church, located at 2801 Rose Hill Road, right here in Fayetteville, North Carolina. And you're listening to Wake Up.
The FDA approved and authorized new COVID-19 boosters Monday as new case counts and emergency room visits slowly rise in North Carolina. The new vaccines from Pfizer and Moderna target Omicron subvariants. The death toll in Morocco keeps climbing following Friday's catastrophic 6.8 magnitude earthquake. At least 2,800 people are confirmed dead and thousands more injured. Law enforcement is pursuing escaped inmate Danielo Calvacante, who is armed with a rifle in South Coventry Township, Chester County, early this morning in Pennsylvania. North Carolina coastal officials reissued warnings on Monday while Hurricane Lee whipped up waves of more than 15 feet as a Category 3 storm cranked through open waters just north of the Caribbean region. The storm is not forecast to make landfall and is expected to stay over open waters through Friday. Mike Rayleigh, NCN News.
WIDU News. I'm Julio Flores. The Spring Lake Board of Aldermen voted to table unsealing 9 sets of closed session meeting minutes on Monday. The minutes range from March 25th, 2019 to April 12th, 2021 and deal with economic development projects that Alderman Raul Palacios said should be open to the public. Before the meeting, Palacios said he disagrees with town attorney Michael Porter on certain points, and he did not specify that he expected the board to table the meeting minutes until after a closed session at the end of Monday's meeting. The Field of Honor, a display of American flags arranged in rows on the parade field at the U.S. Army Airborne and Special Operations Museum every fall, was unveiled Monday. Family and friends sponsor flags in honor of the memory of loved ones who served in the U.S. military. The 16th Annual Field of Honor will be on display through November 12th at the downtown Fayetteville Museum. Renee Lane, the executive director of the Airborne and Special Operations Museum Foundation, says there are 500 flags on the parade field this year, with 54 additional flags surrounding monuments and the Iron Mike Circle. We do local news every weekday morning on WIDU.
Our temperatures today will climb into the mid-80s and the lower 90s, but we have a front that's going to move through, and that's going to allow our temperatures to crash by the end of the week, leading into the weekend. A more comfortable and refreshing air mass will move in that will make it feel like fall. We will see those isolated showers and thunderstorms move in late this afternoon into this evening and tonight, but once that front clears the area late on Wednesday, we are going to see beautiful conditions move in. I'm meteorologist Peter Sherwood in the Weather Center.
Bryan Honda presents the 2023 WIDU Anniversary Celebration, Friday, October 27th, 6:30 p.m. at Kingdom Impact Global Ministries, Fayetteville, North Carolina. Traditional gospel night featuring Doc McKenzie and the highlights. Lisa Knowles and the Brown Singers. And Stellar Award winner Zacardi Cortez. It's a night full of praise and worship. Don't miss the McDuffies, the Virginia Airs. And due to COVID, it's been 4 years. So let's celebrate together at the WIDU Anniversary. Early bird advance tickets on sale now. Just $20. Available at WIDU and the usual ticket outlets. Friday, October 27th. Doors open at 5:30 p.m. The WIDU Anniversary at Kingdom Impact, Fayetteville.
Hi, this is T.W. Campbell.
And I'm Patricia Campbell.
Of the Refuge Community Church, located at 2314 L.A. Dunham Road here in the God Bless city of Fayetteville, North Carolina. You can reach us at area code 910-483-6477. We're here to invite you to our early morning service each Sunday morning beginning at 8:30 in the morning. Our prayer is at 6 o'clock, our intercessory prayer. Bible studies at 7 o'clock, which now is our Sunday school at night, and which we call the Word on Wednesday. Come and be a part of a growing community. In Jesus' name.
Amen.
God bless you. I'm Pastor Al McAllister, the pastor of Rafa Ministries Family Centers Incorporated, and we're asking you to join us for our worship services every Sunday morning at 8:45 to 10:15 a.m. And our Bible studies is every Wednesday at 7 p.m. to 8:30. Join us. We are located at 2520 Murchison Road, WIDU radio station. If you really want to come for a Power Pipe worship service and Bible study to learn what the Bible say about your everyday life, please join us. Al McAllister, pastor of Rafa Ministries Family Center, 2520 Murchison Road. Join us. God bless you.
Upzone is proud to present the Fayetteville Upfront City Council Forum Thursday, September 14th at 6:30 p.m. Get ready for an engaging discussion by the City Council candidates. Live streamed from Upzone's Facebook and YouTube page Thursday, September 14th.
This is Pastor Reginald Johnston of My Father's House Christian Church. You're listening to Wake Up.
I am Sarah Alford, the pastor of Joy Fellowship Outreach Ministry, located at 18336 Highway 87 West in Tar Heel, North Carolina, and I am excited to be a sponsor of Wake Up.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Joining us for the second segment of the broadcast, Ms. Kristen Keefe. Kristen is the mobile recruitment coordinator for Cape Fear Valley Health's Blood Donor Center. Kristen, welcome to the broadcast.
Hi, Omega. How are you?
Doing fine, doing fine. Now, first of all, Kristen, breathe. Everything is going to be fine. All right. Kristen, I talk about this during every broadcast. The importance of blood donation. Why is blood donation so important?
Blood donation is extremely important because a lot of people think like, oh, you only need it if you get into a car accident or if any kind of trauma really. And like that was said earlier, those who have diseases that need blood, those who find out later on that they end up needing blood that maybe were very healthy for majority of their life, like me, you want to go ahead and give it now, give it always, so that way we always have it there for if you need it, if someone else needs it. Blood is super important for us all.
This is something I really want the community to understand because there seems to be some confusion, and I just want to get this cleared. Who does Cape Fear Valley's Blood Donor Center collect blood for?
Cape Fear Valley, we collect blood for our community. So when you come into our center or you go to our mobile drives, you are giving blood to your neighbors, to your community, to your friends, to your family, to the people you see on television. When you see it come across there was something that happened in Fayetteville that day, you can say, wow, my blood might have went to that family that just came across that screen. You just never know who in your community you've helped.
So I've heard that other blood centers that say that they provide blood for local hospitals or our community. Is that true?
It's interesting because it's a yes and no.
Okay.
Yes, have they given us blood when we bought it from them? Yes, we have to purchase the blood from other blood banks or blood centers. As far as giving us blood, we do not get blood from anyone that isn't purchased by us. And again, it's a national shortage, so that's even if we are able to buy the blood from those other places.
Ladies and gentlemen, Ms. Kristen Keefe on Making Rounds Live. Kristen is the mobile recruitment coordinator for Cape Fear Valley's Blood Donor Center. And if you want to be part of this, can I talk today, please? And if you want to be part of the broadcast, what you can do is give us a call at 910-483-6111. That's to the WIDU studio. Or if you're watching the live stream on Cape Fear Valley's Facebook page, what you can do is leave the question in the comment section, and Lindsay will make sure we get that question answered for you. Kristen, can anyone donate blood, and what are the qualifications?
Yes, anyone can donate blood. There are things that may prevent you from it, but the only way to find that out is if you can call us at 615-LIFE. You could come into the center. We do a screening every time for those who come in to donate. So if you aren't sure, or if you think that there's something going on with you that prevents you, we all would rather you come in and just let us tell you if it's something that you can or can't do, because a lot of people think that they can't for different reasons, and they absolutely can. So as long as you've ate and your hemoglobin's high, and we can test that for you as well when you come in, you are able to give blood.
What blood types are needed most?
All, any and all. There is no blood type that is needed. Blood shortages, like I said, nationally. So if you are a human being, we want you to come in and donate blood.
All right. Is there still a need for more representation from certain ethnicities in our community?
There is, but there is also still the need for everyone to donate. So I don't want to say, oh, just this ethnicity should come in. Everyone needs to come in. Like I said, it's nationally a shortage. It's currently a shortage in our area. We need everyone, but we would love to see, other ethnicities just besides it. There's no particular one that has to come in. We want any and everyone.
You want everyone to come in. Kristen Keefe, ladies and gentlemen, on Making Rounds Live. Kristen, since it's Sickle Cell Awareness Month, we've been talking about the disease with Alazio during the first segment of the broadcast. Can you donate if you have the sickle cell trait?
You can donate if you have the sickle cell trait. We want you to come in. All of our blood, it does get tested. So, you don't have to worry about what you do or don't have. Just come in, let us do the evaluation, do our screening on you. But if you have the trait, yes. And honestly, like I said, and like he had said previously, when you donate in your ethnic group, you are more likely to match better, especially a lot of different types of blood are sometimes found in certain ethnic groups. So primarily if you see like O and B are primarily in African American donors. So if you have a sickle cell patient with one of those blood types, if you have that blood type, you're going to be a higher candidate to match with them for a blood transfusion.
Social media question came in during the break, Kristen. What if you're on blood thinners? Can you still donate?
You can't unless you're able to come off, but that is also a medical, like for your doctor to tell you. And when it comes to medication, I would suggest calling in so you can get those answered, because it's specific medicines for specific days that either you have to be off of it. So I would call in and just let the wonderful phlebotomist know what you're on, what you have. They can kind of guide you there. If it's a question about medicine, whether you should come off of it or not, that is for your doctor. So I would definitely go speak to your physician before making any decisions when it comes to your medication.
Okay. Now, this surprised me. I read that those who have visited Europe cannot donate. What's wrong with Europe? Why can't they donate?
That was from when the mad cow disease had been around. That actually has been lifted from the FDA.
Okay.
That was an FDA regulation that we are very, very happy that has been lifted, because a lot of people were military during that time. They were over there and they haven't been able to donate. So we've been trying to get it out into the public. Hey, please come in and donate. That particular regulation is now lifted. So we'd love to see you come in.
And how often can a person donate, Kristen?
You can donate every 8 weeks or every 56 days. So basically every 2 months, we'd love to see you come in.
All right. Kristen Keefe, Mobile Recruitment Coordinator for Cape Fear Valley Health's Blood Donor Center, on Making Rounds Live today. Kristen, I'm one of those people that don't like needles. Does it hurt?
Not as bad as you think it does. I mean, you're getting stuck, but it's not. Everybody has this fear that it's this brutal pain. If you've ever went to your doctor's office and had to give blood in a little tube, it is equivalent to that. You looking at it, I think, affects you more than the actual sticking happens.
Okay.
So, yes.
Is there anything special that donors need to know before they donate?
Just to eat a good breakfast, try to have a good dinner the night before, get a good night's rest, and this, like, just your normal healthy protein meal. When you get up in the morning, try to drink as much water as you can. You want to stay hydrated. Staying hydrated also helps after you donate, so that way you aren't feeling as groggy because you were more hydrated once you gave.
Okay. Kristen Keefe, once again, ladies and gentlemen, on Making Rounds Live. Kristen, how does the blood donation process work? I guess, how will you feel afterwards? I'll go ahead and put that question in there also, because I have seen folks that are on borderline passing out after they have donated blood.
Right. So the process is, like I said, if you have a good breakfast, because a lot of the times when you see that borderline passing out, they didn't have breakfast that day. They ate a muffin. They drank a energy drink. You've got to have a good water. Don't just chug your coffee and come in. You want to have something good on your stomach. When you come in, you're going to have just a government ID, show us, your name and date of birth, and then you'll go into the screening room. They'll screen you, make sure, that you aren't on any medications that make it where you aren't able to donate. Make sure just everything's good health-wise for you. Then you'll go in and you will give blood. It takes, honestly, once you're in the room getting stuck, it's about a 10 to 15-minute flow, just depending on how fast your blood flows out.
All right. Folks who play sports, going back to work, if I donate blood, does that mean that I have an excuse for not going back to work for the rest of the day?
For as far as work goes, no. I mean, unless you don't feel well, we of course would tell you, just to take it a little easy. But as far as sports go, we do not recommend you play sports the day of. So if you are going to give blood, go ahead and prepare to have that day off, like from working out or doing any physical activity. By the next day, as long as you stay hydrated and eat a good meal afterwards as well and a good dinner, you should be fine the next day to play sports, to do anything, any exertion.
Now, you keep saying stay hydrated and eat a good meal. Those are very important issues, or not issues, but those are things that you've got to do.
Those are things. And that's where, when you said that the passing out part, a lot of the times between not eating, not drinking, and getting yourself more anxious to donate is what that leads to. So as long as you stay calm, eat a good meal, drink some water, it's a fast, easy, smooth process.
Now, this is a heartbreaking question, but listeners and viewers, they need to know this, Kristen. What happens if the donor center doesn't collect enough blood?
That is probably my favorite question that you've asked, because I am very, very passionate about this. The biggest problem with us not collecting blood is if we don't collect it, we have to buy it. If we can't buy it, we don't have it. So first things that's going to happen is if you have an elective surgery, you're not going to get it, because that blood's got to stay for those patients who are sickle cell and need it, those patients who have a trauma who need it, those patients who truly need it that have to have it to survive. If we don't have enough blood, or we run out from that, then we're talking about lives. We don't have blood to save those lives. So we need blood because we need it to save lives. That is the biggest reason and the biggest problem with us not collecting enough.
If we have listeners and viewers listening and watching, they can't donate blood, are there other ways that they can help?
Absolutely. So, fun fact is I cannot donate blood because I have a blood disease. However, I am a recruiter because I have a blood disease. So you are also a recruiter. If you know someone, if you see me on here, your neighbor, and you know that one day someone might need it, just go out and just tell people to donate. Hey, I can't donate, but you can. You can save a life today. I may not physically give blood, but I go out, I come on these shows, and I'm here telling you, please give blood so I can save my coworkers, my family, my friends. And that's sometimes more important than the person, that is able to give, because, hey, you're trying to get it out there just as much as they're giving.
Kristen, someone out there listening or viewing, they're going to say, With technology with the way it is, there is a substitute for blood. Is there a substitute for blood?
There is no substitute for blood. You cannot make blood in a lab. You can only have a donor come in and give blood. So you can only save a life by giving that blood.
Ms. Kristen Keefe, Mobile Recruitment Coordinator for Cape Fear Valley's Blood Donor Center on Making Rounds Live. Kristen, why should local businesses host blood drives?
Local businesses are kind of the root to our community. You want to shop local, so that's the same thing kind of with blood. We want it to stay local. So we want our blood to come from this area. So having a blood drive at a place that is local, it also helps show, hey, let's support our local business while also support our local family and friends and neighborhood. So we would love to have it at any and all places in the area, just to promote it, and also to get as many people as we can to come in and donate, because a lot of people don't realize, it's a really smooth and easy process. And once you have that fear over with, we have a lot of people that are first time and they're scared, and they come in and then they are there for life.
Let's talk about the difficulty of coordinating one. You're going to have someone that says, it's too hard for me to do. I'm not even going to try. What's your answer?
My answer, honestly, is as long as you try at all, put an effort out there, put up a flyer, have us come, have our truck there. A lot of people come and they don't think about us coming to our location, but when they see that bus and it says, give blood, give life, they're like, hey, you know what? I have 30 minutes. Let me just hop in there. So honestly, hosting that blood drive isn't as difficult as a lot of people think it is, because when they see that, they're like, hey, let me get on there. Let me go save some lives today.
It is a rolling billboard. That's for sure. Yes. All right. What if I want to find out if there's a blood drive in my community or near me? Where should I go?
So we have our social media pages that we usually post to all of our drives for the upcoming weeks. And then if you would like to see them listed out, you can go to www.capefairvalley.com/blood, and it'll have our drives that are all coming up, and what times, dates, and the location.
What if I wanted to go to the actual center and donate? What are your hours? Where are you located?
We are at 3357 Village Drive. We're open Monday through Friday, 9 to 5, and every third Saturday, 9 to 3. A lot of people understand it better if I say we're in Bordeaux Shopping Center, right across from Cape Fear Valley's main emergency department.
All right. Well, ladies and gentlemen, this wraps up the segment with Ms. Kristen Keefe, Mobile Recruitment Coordinator with Cape Fear Valley's Blood Donor Center. Now, before we close out today's show and before I do my housekeeping, let's go back around to both of you. Is there anything that you want to say? Any final thoughts?
Yes, I would love to say that we are partnering with Cape Fear Valley Blood Donor Center on September the 30th. We will be hosting our Sickle Cell Awareness Block Party at Honeycutt Park, and they will have their bus out there collecting blood. I am challenging each and every one of you to bring yourself along with one other person so that we can collect the blood that our community needs. At September the 30th at Honeycutt Park from 11 a.m. to 3 p.m., we're going to have free food, fun, and games. Please, 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 please come out and donate.
All right. Kristen?
I want you to donate, especially at that event, but also leading up to it if you would like. We have multiple drives leading up to there as well, but we would love to have you come out and donate and enjoy free food and have a good time. And we do give snacks and drinks and giveaways out to our donors. So if you'd like to come get something special as well that day, please head on out there on September 30th.
Awesome. Well, ladies and gentlemen, before I close out, once again, please join me in thanking our guest today, Ms. Kristen Keefe, Mobile Recruitment Coordinator with Cape Fear Valley's Blood Donor Center, and, of course, our friend, Mr. Alazio MacArthur, Program Director of Piedmont Health Services and Sickle Cell Agency. Now, before we close out today's broadcast, I want to make one final shout out to thank everyone that made the Umoja Festival happen last month. If you missed it, all I can say is you missed a good one. Join us next year. But it was a good cause. It's a good cause for the community. Hundreds of people came out to participate in Cape Fear Valley's free health clinic that was out there. We also enjoyed the music, the festivities, the pageantries, E.E. Smith's marching band. All of that was going on outside Seabrook Park that day. And I want to thank everyone once again who all participated, and especially everyone who attended to make it a success. We greatly appreciate the love and the support, and we hope to see you again next year at the Umoja Festival. So, ladies and gentlemen, I need you to mark this date down. Tuesday, September 26th. We'll be talking about Sepsis Awareness Month, and we'll be talking about Medicare open enrollment. Oh, I'm looking forward to that discussion. I love when we talk about Medicare open enrollment. For our producers, Shaka Jordan and Ray Thomas, our social media coordinator, Miss Lindsay Graham, and everyone that works hard behind the scenes, I'm Omega Jones. Thank you so much for listening to Cape Fear Valley Health's Making Rounds Live.